Hello, my name is Edward Fruitman. I'm a board-certified psychiatrist and I'm a medical director of Trifecta Health. Welcome to this YouTube video on our YouTube channel. Lately, I've been asked about special issues that people with anxiety and panic disorder may be experiencing at this time of COVID-19 epidemic. And it's a very relevant question because people who already have certain fears about their safety, fears of infection and contagion, and certain fears of being outside or being in an unsafe environment. Of course, all of those fears are now becoming exaggerated. We are bombarded by terrible news and from news channels and alarming reports from our officials. And I've seen and heard of people who get so fearful and so panicked about the virus, the COVID-19 virus, coronavirus, that they're even too fearful to open a window in their apartment or house. My recommendation for people who normally suffer from anxiety and now seeing a marked increase in their symptoms due to protective self-isolation and quarantine. One is, don't listen to the news obsessively. Maybe turn on the news for 15-20 minutes. Focus primarily on reports from Center for Disease Control, for CDC, and reports from local health department. They are well informed and they're really trying to do their best to give relevant information to the public. And really try to understand what the guidelines are. Measure out 6 feet. When it says social distancing, personal distancing, measure out 6 feet to see how much 6 feet is. It's not all that much, so it's really staying away from people at a much greater distance isn't practical and fills you with constant fear. Also understand exactly what the protective measures are and try not to engage in excessive measures, because that after a while becomes a standard, and this will be a habit that's very, very difficult to shake. And another suggestion that I have is make sure you don't stop doing things that you don't have to stop. Rationally think about what is it that you are not supposed to do, and do everything else. Don't avoid taking a walk with your dog. Don't avoid going out on a semi-empty street. Try not to constrict your lifestyle any more than necessary, because such behaviors of hiding and self-isolating, if they're excessive, they become very addictive. It's very difficult to start doing things again, let's say once the epidemic is over. So try not to lose your ability to leave the house without fear. Try not to lose your ability to communicate with other people without fearing that you may get some kind of a contagion. So this is Dr. Fruitman. We'll see you in the next YouTube video.